So this month we're going to be reviewing bloodborne pathogens and infection control. So what are bloodborne pathogens? Infectious materials in the blood that can cause disease in humans. The most common forms are hepatitis B, C, and HIV. All of these can cause serious risk or death. Hepatitis is an infection that is transmitted through the blood or other infectious bodily fluids, and HIV is most commonly spread through sexual contact, but can also be spread through the bloodstream as well. So, as caregivers and other healthcare providers, we have to be concerned by this because blood is something that you may come in contact with. Clients may have cuts or open sores. They could have abrasions or acne or anything that might cause them to have broken skin. This can also occur on yourself. You want to make sure that you don't spread anything to anyone else either. Even if your skin is chapped or you have a blister, this can spread bodily fluids. So you want to make sure that you're always protecting your hands so that you and your clients are protected. If you get accidental punctures, if you have broken skin, any of these can cause the spread of blood between persons, which is something that we always want to worry about and always prevent. So if an accident does happen or an exposure, the first thing you want to do is not panic. You want to clean the area where you or your client were exposed, flush the area with water, or if saline is available, you can use that as well, and just make sure that it's irrigated as much as possible. You also want to make sure that you report that incident to the agency that you're working for. So here at our agency, we keep track of all exposures. Even if it ends up being nothing, we want to make sure that we keep track of it and that we assist our employees with getting medical assistance if needed. So make sure that you report to them exactly what happened, write down the details so that you don't forget anything, what area was exposed on you and your client, what sort of fluids were exchanged so that you know exactly what happened and you have notes of it. And then you can also seek follow-up and medical attention if needed. So healthcare agencies all run a infection control program. So infection control is to prevent the spread of microorganisms. These spreads can be from patient to patient, patient to staff member, or staff member to patient as well. And you want to do everything that you can to prevent any exchange of microorganisms so that you can reduce the spread of any sort of illness. So infections can be transmitted in 3 different ways. Direct contact, so that is when you directly come in contact with someone else's blood with your own open wound or some sort of contact. Indirect contact can be if the infectious material was contaminated by blood and then you touch that infected material. And vectors by any sort of bugs or insects that might be carrying something infectious. There are 3 things that need to be present in order to spread an infection. So an infectious agent that is carrying some sort of virus or bacteria or fungi, a susceptible host, that is the person that is in the weakened condition that might have an open wound or an open cut, and the chain of transmission for the infectious agent to move to that open or weakened host. So practicing standard precautions or universal precautions is working under the assumption that everyone is sick. That is assuming that you yourself might be carrying something infectious or your client that you're working with might be carrying something infectious. This basically keeps you on your P's and Q's all the time. If you assume that, then that means that you'll always be worried about protecting yourself and your client. You'll also be practicing the same precautions with every person you work with. So to do that, you always want to make sure that you are washing your hands. Washing your hands will prevent the spread of a lot of infections by making sure that your hands are cleaned and that you're washing them between activities and also between clients. That you wear gloves if you ever may be at risk of coming in contact with blood or bodily fluids that are not your own. That you clean and disinfect any area that has been exposed or could have been exposed to blood or bodily fluids, and that you wear PPE when you may come in contact with any blood or bodily fluids. So this is wearing gloves, wearing a mask, all those types of things when you might be in at risk of spreading some sort of infection or like coming in contact with an infection. So make sure also that you are following the agency's guidelines on exposing of materials that may have blood or any sort of bodily fluids on there. When you end up having to come in contact with those, that you're using gloves to make sure that they're cleansed properly, or if they need to be disposed of, that they're disposed in containers where they will not come in contact with anyone else. In the event that you are exposed to something, you always want to make sure after you take care of your immediate safety concerns with you and your client that you report that to your immediate supervisor. You want to make sure that you seek medical evaluation if you require it, that you seek any treatment that you need to be taken care of, and then also the supervisor, if there is some sort of exposure, may need to notify the public health department. This happened a lot during COVID. We had to notify every time that a client or an employee was exposed to COVID-19. We reported it to the public health department to let them know that we had had an exposure. This is how they came up with those counts that they were pulling out and letting us know every day if the numbers were getting higher or lower, because a lot of healthcare professionals were having to report every single time they came in contact with someone who was exposed. So here is a couple of quick tips just to remember and try to follow. So you want to make sure that you treat all blood and bodily fluids as if it was contaminated. This is what we talked about with universal precautions, using standard precautions, assuming that everything that you touch with blood or bodily fluids has something in it. That will keep you safe, and always make sure that you're careful. You want to wear PPE in exposure situations. If you know your client has an open wound or something like that, you want to make sure that if you do have to touch them or help them bathe, that you are wearing gloves to protect your hands. You want to replace PPE that is ever torn or punctured. So do a review of your gloves when you put them on. Make sure there's no holes in them, no tears, things like that. And then you want to remove your PPE before you leave work. So don't get back in the car with your gloves on. Remove those off, taking the gloves off backwards, and make sure you dispose of them. You want to make sure that you're disposing of any PPE properly. So making sure you're putting it in trash receptacles that are sealed, so that when you're throwing those items away. And then after you remove your PPE like gloves, you want to go ahead and hit the wash your hands, make sure that they're cleaned properly before you move on to your another client or even getting into your car. So that is it for our quick review on bloodborne pathogens and infection control. Make sure that you take our quick quiz to test your knowledge, and make sure you get that in before the end of the month. If you have any questions about this, please let us know. We want to make sure that everybody understands these procedures and is able to protect themselves in the situations that they're in as caregivers.